This is really just a way of introducing the idea that if you happen to have an affective disorder like depression or bipolar disorder, you're more likely to also have an issue with substance use.
By the tune
in fact, healthy controls in the normal population, 6 to 12% use substances, illicit substances, 14 to 65% if you have a psychiatric condition. That's a big difference. It means that we really need to be paying attention to what we call comorbidity, or what happens though if you have both. They're more similar than different. When we look at people who don't smoke marijuana versus people who are heavy smokers, I mean chronic cannabis smokers, what we see is controls greater than smokers. So what do controls look like in terms of the brain? We see the same areas of activity that we've seen in lots of our studies. This is the part of the brain that, this is the anterior cingulate, perigenual and just anterior cingulate. In healthy controls greater than smokers. Look at the smokers. Now, performance-wise, they did just as well. There's no difference between the groups. But look at this, mid-cingulate, much further back. So when we look at patients with bipolar disorder, controls about same task, controls greater than bipolar, sort of the same thing that you just saw. That's what we'd expect a little further back in this sample of controls. These are different samples. Look at the bipolar patients, same thing. Posterior, mid-cingulate to posterior. So what's the common link? Why do you see that? Why do smokers and bipolar patients look sort of similar? Well, maybe because there's a slight disruption in that same circuit. Doesn't mean you're not doing it just as well as someone who doesn't smoke or have bipolar disorder. Just means you do it differently. And that's what we have to look at for treatment strategies.